Hello, I'm Dr. Sam Robson, and this brief webinar is all about the Kickstart program available at Temple Clinic. Kickstart is for everyone, whoever you are, whatever your lifestyle, your age, your sex, or your occupation. If you want to take control of your health and well-being, then this could be the ideal place to start. But let me explain this more. Over the next few slides, I shall highlight some of the prompts which may convince you to engage with Kickstart. If you go to the gym regularly, but you're just not getting the results you expect or would like in terms of your weight, fat loss, or muscle definition, have you ever considered why not and questioned what you could do differently? At the end of the day, you can't exercise off a bad day, and there is a lot of truth in the saying that you can't outrun your fork. Exercise without appropriate nutritional changes just won't work if you're looking to improve your body composition. So where do you go to get this information? One of the problems with getting older and becoming more successful is that you easily can become less active and become less fit. You now have enough money to drive a comfy car and you can eat and drink whatever and whenever you want. But deep down, despite your success, you know that you need to do something different to improve your health. But change can be hard, and even more so if you don't know where to start. Your push into making a change to your life could be when you or someone you care about has had a health scare and the doctor tells you or them that the time has come to make some changes. This strikes a chord, but again, you don't know where to begin. Perhaps there's an important event in your social calendar where you really want to feel and look your best. Whether you're part of the bridal party or just a guest at an important wedding of a family member or close friend, we all want to look good in those photos, but sometimes the how and with what to make a change can seem overwhelming, and if we're honest, it can also feel too much like hard work. Sometimes a significant birthday is a typical reminder of youth and fitness slipping away. Can we mark it by looking and being in better shape? But again, where do you start? And of course, the beach holiday. We've all been there. The dread of exposing the excesses of the winter months when we just know that our bodies are not yet ready for the beach. But how are you going to do this in time when realistically it's not a last-minute job? And finally, let's not forget that there can be many sad and challenging life events like divorce, bereavement, or even losing your job. This can actually provide the perfect opportunity to reevaluate everything, make a priority of your health, and perhaps consider doing something differently. With 50% of the population being overweight, and the prediction that by 2025 this will be 50% of the population being clinically obese, surely now is the time to address this. But again, the biggest hurdle can be knowing what will work and where to begin. So Kickstart is all about starting afresh and rebooting your lifestyle. It's about applying common sense based on credible science. So do you know what you're doing or where to start? There's so much conflicting advice and miracle cures out there, and you can't pick up a magazine without reading about the latest fad diet and celebrity fix, and social media is just a minefield. Surely you only want to invest in something that will genuinely work. Our goal is to help you get to where you want to get to by finding out where you are now, exploring what you need to do differently, and discussing how to make gradual changes and then monitoring your progress along the way, kind of like a map. Over the next couple of slides, I shall talk you through the basic aspects of the Kickstart program. The in-body machine is an invaluable tool that teaches us much about your body composition. It informs about your ideal weight, your percentage body fat, and how much fat is packed around your organs, which is a good indicator of your risk of having a heart attack, developing cancer, diabetes, or stroke, where the muscles are in your body, and how many calories you need just to survive. This is an example of an in-body report, and Dr. Sam will go through your report in detail at your appointment. She will use this report to advise about your body composition and provide a breakdown of your vital statistics. As well as your weight, you will learn about your percentage body fat, where the muscle and fat is in your body, your visceral fat, your resting metabolic rate. Armed with all this information, Dr. Sam can then discuss what changes in body composition you would like to see and how to go about achieving this. So, before seeing Dr. Sam, you will be asked to keep a 5-day food diary, and it's important for this to cover a weekend when eating behaviour and choices can change. This helps her understand what you choose to eat and your pattern of eating behaviours, and this will guide her recommendations on changes to consider. A prescriptive plan will be more effective if she knows what you currently prefer to do. She will devise a nutritional plan based on your current food choices and advise how these could subtly change to work more effectively for you. She will advise on calories and what would be the right amount of macronutrients in terms of protein, fat, and carbohydrate. Although she'll provide a template of food types, it's never so restrictive that you can't make choices on what you would prefer to eat. The goal is for you to understand how to navigate the choices of the supermarket, restaurant, your own fridge, and the challenges set by your friends and family and busy lifestyle, whether you are travelling, have kids, a demanding work schedule, or just don't make time to prepare for eating. She will also provide guidance on recipes or online learning and places to get the foods that will support your goals, as well as apps that are easy to use and make sense. So what about the fitness? The exercise assessment is all about what you can do already, what facilities you have access to, and how you could fit exercise into your life. We are all short of time and often full of excuses, but the question is, when could you make exercise work for you if you're busy, and what exercise will most efficiently achieve your goals in both the short and long term? The type of exercise you enjoy is also important, since you're more likely to find time to factor this in if you actually have some fun whilst undertaking it. Your in-body assessment will provide some useful information on the muscles you already have, and Dr. Sam can advise on how to improve this. This is an example of a Kickstart success. This young lady lost a total of 8 kilos, which is about 1¼ stone. As well as following the basic dietary advice and stepping up her exercise, she also chose to have a package of body contouring treatments. Over the course of 4 months, she dropped her body fat from 32% to 26% and has been able to maintain this with little difficulty now that she's more aware of what she eats and her lifestyle actually keeps her fit. The in-body was invaluable in helping her to understand her body composition and then monitor how it improved over time whilst paying attention to her diet and exercise regime. So what are the costs? As explained, the basic starting program includes the nutritional assessment, an in-body profile, a fitness overview, and a personalised exercise program giving guidance on diet and exercise. This costs £99. Now you may wish to involve body contouring options, which will be explained in more detail if this is of interest. And if you invest in a package of body contouring, then you'll receive a complimentary Kickstart review at the end. Otherwise, ongoing reviews are priced at £75. So what are the benefits of Kickstart? Well, I liken the advice and support to being dropped in the jungle with or without a compass and a map. Without the compass and map, it can be confusing to work out where you are, what direction to take, and how you're going to get on. With Kickstart, you know more about how to get to your destination, and you can also check in regularly to make sure you're going in the right direction and are making good progress. I believe that Kickstart puts you back in charge and you will become more confident about the benefits of making changes. Not only will you feel better, fitter, and in better shape, you will also see objective changes, evidence of the changes using the in-body. At the end of the day, it's all about choices. What are you waiting for? And which person here would you rather be? If you think Kickstart could work for you, then please contact us for more information.